Good evening, and today I'll be continuing with the antifungal drugs. In today's class, I'll be dealing with the second category of antibiotics, that is heterocyclic benzofuran. And under heterocyclic benzofuran, we have griseofulvin drug. Griseofulvin drug. Now, this is being extracted from penicillin griseofulvin. Penicillin griseofulvin. And due to its lack of antibacterial activity, it was given a very less attention, and the clinical utility in dermatophytosis was demonstrated, and after that we began to use this particular drug. Now let us see about its antifungal spectrum. It is active against most dermatophytes, including epidermophyton, trichophyton, microsporum, etc. But it is not very active against the Candida species and other fungi causing deep mycosis. The bacteria, they are also very insensitive to this particular drug. Now, resistance can be seen in vitro, and this is associated with the loss of concentrating ability. Now, if you see these dermatophytes, they actively concentrate this particular drug, and this feature probably accounts for its selective toxicity. So due to that, the resistance can also emerge. And griseofulvin will be interfering with the mitosis phase. Okay, so it will be interfering with the mitosis. It causes multinucleated and stunted fungal hyphae, which results from its action, and it causes abnormal metaphase configurations, and the daughter nuclei will fail to move apart, or they move only a short distance. It does not inhibit the polymerization of the tubulin, but binds to the polymerized microtubules and somehow disorients it. Alright, so this is how this particular drug will be acting inside the body. So it will be interfering mainly with the metaphase of the mitosis, and it does not interfere, or it's not going to inhibit the polymerization, but it goes and gets itself attached to the microtubules so that it gets disoriented. Now, pharmacokinetics, if you see, the oral absorption from the gastrointestinal tract is irregular, so because of its low water solubility. So absorption of this particular drug, griseofulvin, can be improved by taking it with fats and by microfining the drug particles. Now, ultra microfine particles preparations from which absorption is still better are available today in the markets. And once it gets absorbed, it goes and gets itself deposited in keratin, and they forming the cells of skin, hair, and nails. And it gets concentrated and gets retained in the tinea infected cells. And because of its fungistatic and not cidal, the newly formed keratin is not invaded by the fungus, but the fungus persists in already infected keratin. So it's not going to kill, but it's going to protect the nails from getting affected, the cells from getting affected, till it is shed off. Thus, the duration of treatment depends upon the site of infection, thickness of the infected keratin, and its turnover rate. And after that, it undergoes metabolism, and primarily by methylation, and gets excreted in the urine. The half-life in the plasma half-life is 24 hours, but it persists for weeks in skin and keratin. Adverse effects, usually the toxicity is very low and not at all serious, but headache is a common complaint we can find, followed by gastrointestinal tract disturbances. Central nervous system symptoms and peripheral neuritis are occasional. Rashes, photoallergy may warrant discontinuation of this particular drug. And transient leukopenia and albuminuria are infrequent, and this will not be causing any renal damage. Uses: orally, it is used for dermatophytosis, and it is effective only once we use it for it. But if you consider the topical application, it is ineffective, and it has been replaced by azoles and terbinafine, which are equally and more efficacious. So this has been replaced by those particular drugs. However, it is reserved for cases with nail, hair, or large body surface involvement, and it is very effective in case of athlete's foot, but not in pityriasis versicolor. And the dose is 125 to 250 milligrams QID, that means 4 times a day with meals, and duration depends on the site of infection, that is a turnover rate of keratin. For example, if it is the body skin, it will be given for 3 weeks. If the palm and the soles are involved, 4 to 6 weeks. Fingernails, 4 to 6 months. Toenails, 8 to 12 months. So depending upon that, the duration of the therapy will vary. Interactions. We'll see what is the interactions with the other drugs. It will induce warfarin metabolism and reduces the efficacy of oral contraceptives. Okay, so it causes warfarin metabolism, and the efficiency of the oral contraceptives will be reduced. And if it is given with phenobarbital drug, it will reduce the oral absorption and induce the metabolism of griseofulvin, thereby resulting in failure of the therapy. So it is better to avoid if the patient is on phenobarbital. And also it should be avoided especially with the consumption of alcohol, okay, because it can cause intolerance to alcohol. So a special care has to be given over here. So that's all about the heterocyclic benzofuran. So with this I have completed antibiotics. That is the first category. Now the second category under antifungal drug is anti-metabolite. Anti-metabolite, and we have the drug flucytosine. Flucytosine. So if you see, it is a pyrimidine antimetabolite which is inactive, and it is taken up by the fungal cells and gets converted to 5-fluorouracil and then to 5-fluorodeoxyuridylic acid. And this is an inhibitor of thiamidylate synthase. Now thiamidylate acid is an essential component of DNA, so this inhibition will be taking place once this particular drug enters into the body. The fungal selectivity of flucytosine will depend on the fact that the mammalian cells, except some marrow cells, they have low capacity to convert flucytosine to 5-fluorouracil. It has got a narrow spectrum of activity. It is fungistatic. It is not fungicidal, it is fungistatic, and it is active against Cryptococcus neoformans, Torula, then Chromoblastomyces, and a few strains of Candida. Other fungi and bacteria are said to be insensitive. Adverse effects. Its toxicity is said to be very low when compared to that of amphotericin B, but it consists of dose-dependent marrow depression, gastrointestinal disturbances, particularly enteritis and diarrhea. Liver dysfunction is mild and reversible. Uses: it is not given or it is not employed as a sole therapy except occasionally in chromoblastomyces. Rapid development of resistance can be noticed especially when it is used in deep mycosis. So its usage in deep mycosis treatment has been very limited. In cryptococcus, that is in case of meningeal and non-meningeal portion, it's synergistic action. Now synergistic action means when two drugs are given, what it will do is one particular drug will potentiate the action of the other drug. So we can say that there is a mutual understanding and both the drugs will come together and they will make the treatment to get completed successfully, and you can see a very good rapid recovery in the patients. So that is what we call it as a synergism. It is one of the actions which are produced by the drugs inside the body. The opposite of synergism is antagonism. Okay, so here there will be a synergistic action with amphotericin B, and it will be utilized to reduce the total dose of the more toxic latter drug. Okay, so with this I have completed antimetabolites, which is a second category of antifungal drugs. Hope you understood the class. Till then, take care. Bye bye.